If you're over 60 and find yourself waking up 2, 3, or even 4 times a night, you're not alone. Night wakings become increasingly common as we age, and they can leave you feeling exhausted, foggy, and frustrated during the day. You might have tried melatonin, blackout curtains, or even prescription sleep aids, but there's a powerful tool you already possess that can dramatically improve your sleep quality, and it doesn't cost a penny. It's your breath. As we get older, our breathing patterns naturally change. The muscles that control breathing can weaken. Sleep apnea becomes more common. Anxiety and stress can settle into our bodies in ways they didn't when we were younger. All of these factors can fragment our sleep, pulling us out of deep, restorative rest and into those frustrating periods of wakefulness at 2 or 3 in the morning. But here's what many doctors don't tell you. Simple breathing techniques, practiced consistently, can retrain your nervous system, reduce those night wakings, and help you sleep more deeply than you have in years. These aren't complicated yoga practices or New Age rituals. They're evidence-based methods that work with your body's natural physiology to promote better sleep. Let's start with why breathing matters so much for sleep, especially as we age. Your breath is directly connected to your autonomic nervous system, the part of your body that controls things you don't think about, like heart rate, digestion, and yes, sleep. When you breathe quickly and shallowly, you signal to your body that you're in danger, that you need to stay alert. This activates your sympathetic nervous system, your fight or flight response. When you breathe slowly and deeply, you activate the parasympathetic nervous system, your rest and digest mode. This is the state your body needs to be in to fall asleep and stay asleep. Many seniors develop a habit of shallow chest breathing throughout the day and night. This keeps the body in a slightly elevated state of stress, making deep sleep harder to achieve and maintain. The good news is that you can change this pattern with just a few minutes of practice each day. The first technique is called 4-7-8 breathing, and it's one of the most effective methods for quickly calming the nervous system before bed. Here's how it works. Place the tip of your tongue against the ridge of tissue behind your upper front teeth. Keep it there throughout the exercise. Exhale completely through your mouth, making a whooshing sound. Close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making that whooshing sound again. This completes one cycle. Repeat this 3 more times for a total of 4 breath cycles. The 4-7-8 technique is powerful because the extended exhale and the breath hold force your body to slow down. It's almost impossible to remain anxious or alert when you're breathing this way. Many people find that practicing this technique right before bed helps them fall asleep in minutes instead of hours. If you wake during the night, you can use it again to help yourself drift back to sleep. The second technique is nasal breathing, and this one is crucial for seniors. Many older adults breathe through their mouths, especially at night, and this can lead to dry mouth, snoring, and fragmented sleep. Mouth breathing also means you're not getting the full benefits of nitric oxide, a gas produced in your nasal passages that helps regulate blood pressure, reduce inflammation, and improve oxygen delivery to your tissues. To practice nasal breathing, simply make a conscious effort to breathe in and out through your nose throughout the day. If you find this difficult at first, it's okay. Your nasal passages may need time to adapt. You can also try nasal breathing during light activities, like walking around your home or sitting and reading. The goal is to make nasal breathing your default, so it continues naturally when you sleep. If you struggle with nasal congestion, a saline rinse before bed can help clear your passages. Some people also find that gently taping their mouth shut at night with medical tape encourages nasal breathing and dramatically improves sleep quality. This might sound strange, but many sleep specialists recommend it. The third technique is diaphragmatic breathing, also called belly breathing. This is the natural way babies breathe, but many of us lose this pattern as we age and accumulate stress. Diaphragmatic breathing helps you take fuller, deeper breaths, which calms the nervous system and improves oxygen flow. To practice, lie on your back with one hand on your chest and one hand on your belly. Breathe in slowly through your nose, allowing your belly to rise while keeping your chest relatively still. Your hand on your belly should move more than the hand on your chest. Exhale slowly through your nose or mouth, feeling your belly fall. Continue for 5 to 10 minutes. You can do this in bed right before sleep or anytime during the day to reduce stress and retrain your breathing pattern. Many seniors find that their night wakings are connected to anxiety or racing thoughts. When you wake at 3 in the morning and your mind immediately starts worrying about health issues, family concerns, or finances, it's nearly impossible to fall back asleep. This is where coherent breathing can help. Coherent breathing means breathing at a rate of 5 breaths per minute, inhaling for 5 seconds and exhaling for 5 seconds. This specific rhythm has been shown to maximize heart rate variability, which is a marker of nervous system flexibility and resilience. To practice coherent breathing, set a timer for 5 or 10 minutes. Breathe in for a count of 5, then breathe out for a count of 5. It doesn't matter if you breathe through your nose or mouth, though nasal breathing is preferred. The key is maintaining that steady, even rhythm. This technique is incredibly calming and can be used both as a bedtime wind-down practice and as a tool if you wake during the night. Now, let's talk about consistency. These breathing techniques won't transform your sleep overnight, although some people do notice immediate benefits. For most seniors, it takes about 2 to 3 weeks of daily practice to see significant changes in sleep quality and a reduction in night wakings. The key is making these practices a regular part of your routine. Try setting aside 10 minutes before bed each night to practice 1 or 2 of these techniques. You might do 4, 7, 8 breathing to calm down, followed by 5 minutes of diaphragmatic breathing to deepen your relaxation. One important note for seniors with certain health conditions. If you have COPD, asthma, or other respiratory issues, talk to your doctor before beginning any new breathing practice. Some techniques, particularly those involving breath holds, may not be appropriate for everyone. Your doctor can help you modify these practices to suit your needs. Beyond the techniques themselves, there are a few other breathing-related factors that can reduce night wakings. First, consider the air quality in your bedroom. Dry air can irritate your airways and make nasal breathing more difficult. A humidifier can help, especially during winter months. Second, avoid eating large meals or drinking alcohol close to bedtime, as both can affect your breathing and increase the likelihood of sleep disruptions. Third, if you snore heavily or suspect you might have sleep apnea, get evaluated. Sleep apnea is common in seniors and can cause frequent night wakings. A CPAP machine or other treatment can make a tremendous difference. The beauty of breathing techniques is that they're completely free, have no side effects, and can be done anywhere, anytime. You don't need special equipment or a gym membership. You don't need to remember to take a pill. You just need a few minutes and the willingness to practice. Over time, these simple techniques can help you reclaim the deep, restful sleep you deserve, reducing those frustrating night wakings and helping you wake up feeling refreshed and ready for the day ahead. Your breath is always with you, always available, always ready to guide you back to rest.